Thank you. And thank you to West Hills College for the opportunity to be here today. I just really appreciate the depth and breadth of their understanding, some of the challenges that they address at Essential Elements, because they have such a diverse group of all of us here in the same room to talk about one issue. And my topic today is telehealth. So how does that relate to all of this farming environment? So first of all, my name is Davena Witcher, and I am the executive director for the nonprofit Amor out of Fresno. I am a nurse by training and spent the majority of my career at Valley Children's Hospital working with preterm babies. And that was a great introduction for me to understand the value of technology, because I was on the transport team that left the comfort of one of the most high-tech hospitals in our Central Valley, put everything that I needed into a tackle box, and was required to get in a helicopter and fly out to a rural community that had no resources and stabilize the sickest of babies and bring them back to Children's Hospital. So going from that very high resource environment out to one of our rural communities and bridging those challenges of no technology was very real for me. While I was at Children's, I had the opportunity to join the board of Amor, and Amor focused on international healthcare. And so we were doing healthcare in a third world country, right? Talk about no resources. But once again, I was able to see how stabilizing the resources of technology in these environments increased capacity for education and for healthcare. I think we're all aware of how connecting the world is a powerful tool. And some of us, probably a lot of us in this room, including me, can remember when we didn't have a cell phone. I can remember when there was no internet. When I was in college, the internet was a brand new thing, right? And there's many of us that can relate to that. And when we think about our own lives and what the internet has done for us and what connectivity with our cell phones has done for us and how it's helped us function better, to take our knowledge out into other communities, to share what we have with those around us, not only in our local community, but around the world, technology is essential. And I almost say that it's a right now. And so when our rural communities right here in our own Central Valley are deprived of that basic, fundamental access, we are limiting the capacity of our children's, our family, and our economic stability. Now, how does that all tie into healthcare and to farming, more importantly? So I appreciated what the Congresswoman said about the development of our economy in a public-private capacity and partnership, and how that needs to broaden access. And I think defining access, whether you're talking about broadband or healthcare or any of the subjects that we're here to talk about today, when you talk about access, what does that really mean? Well, my nonprofit, Amor, our second project is going to be in Mendota. And I have spent the last 3 years researching what the needs of rural communities all across California need in order to thrive. And it's a pretty long list. So it's not just about healthcare, but it's social services, it's youth services, it's job opportunities. And one of the underpinning factors for all of that is access to broadband so that we can have quality education and opportunities brought into our rural communities. When I translate that healthcare into your sector, the first thing that I think of is stabilization of the workforce. Your workforce is constantly churning because of the lack of resources to your families right out here where they work and live. And so that is the problem that Amor is addressing in Mendota, and once we get that solved there, we'll be transplanting that model out into other rural areas. Let's talk a little bit about the specific problem of the shortage of physicians and how that impacts your workforce and rural areas, and then how broadband can fix that problem. According to the federal guidelines by HRSA, it's recommended that there are 60 to 80 physicians per 100,000 individuals, 60 to 80. In Fresno County, that number is 39. So already when you're talking about access to health care, and that means for you as employers, not only for your workforce, for your workman's comp, for your preventative health, already we're at the 55% of what is considered appropriate access at a federal level. So that's just, if we're going to get past that, we have to have access to a place that has appropriate levels of physicians and specialists, regardless of which specialty you want to think of. That's the Bay Area, right? And in order to get healthcare services from the Bay Area into our rural communities in the Central Valley, we absolutely have to have broadband access. The problem is compounded further by the fact that the majority of the people in our rural communities are on Medicare, Medi-Cal, or are undocumented. And so you can imagine that the number of physicians that actually accept that type of insurance or will provide health care for those sectors drops even further down to 25 physicians per 100,000 population. Extremely small. In addition to that, we have insurance silos. I think all of us are probably aware that as the changing scope of our healthcare model is continuously evolving, that where I can go to see a physician today may not be where I can go see a physician tomorrow, right? And so how do we broaden out that capacity? It's through telehealth. Not to mention the thing that I think we all feel when we're getting ready to access our health care is the need for transportation to get there. And so, you know, it's a challenge for me to have to drive from Fresno to San Francisco to get to a specialist. But when we take that out to our rural communities, how much more challenging is it for your workforce and for their families and children to make that trip up to San Francisco to see a specialist? It's almost impossible. They have to miss work. They have to come up with money for gas. They have to find someone with a car. And so these types of challenges are just compounded, and telehealth is one of the ways that we can effectively address this issue in our rural communities, with not to mention what we're doing at a state and federal level of trying to increase the amount of education that's available at these levels. So what is the solution? So telehealth, and you know, none of this is a fix-all, and I think we're all aware. Broadband is a tool, right? And that's one of the uniqueness of all of us here, is that we're looking at how can we make this tool available so that all of us have the benefit of this one thing that we can use in regardless of what sector we're in, and take it out to benefit our rural communities. So clinic health care is extremely important, and this can be broadened out in the behavioral science, public health, and education sectors simply by having that broadband connectivity to numbers of organizations all across the state. It's essential that the bandwidth, and I'm a nurse, but I hear this term bandwidth. So when we were seeing that slide earlier about 1 to 5 megabytes, pixels, whatever they are, right? 1 to 5, 5 to 30, like this, right? When we're talking about telehealth, I need enough bandwidth that the physician sitting on the other end can have an interactive conversation with his patient in real time. That takes bandwidth. And so broadband is essential to providing access to these rural communities. Of course, treating chronic diseases is a huge problem and challenge in rural communities because so much of our workforce has not had access to healthcare for the majority of their working lives. So I was very surprised to find that retirement age for labor force is about 49 to 50 because so many of them have chronic disease like hypertension, diabetes, that has gone undiagnosed and untreated for the majority of their life. And so this winds up being a major problem much earlier in their life. And so we want to be able to address that. And in the long run, I think we'll stabilize the workforce so that you have reliable workers that can contribute to our community and part of our economy right here in California. So thank you so much.
Good. Thank you.